Hello, welcome to the Learning Curve. I'm Marjorie Began. My guest today is Al Whitaker, Northeast Region Director, Community Health Strategies for the American Diabetes Association. Thank you for joining us once again.
Thank you for inviting me. Yes, it's good to be back again.
For those people who may not know, can you give me just a brief explanation of diabetes?
So diabetes, basically what diabetes is your pancreas is an organ in your body that basically produces insulin. So the example would be, say I have a meal. So 2 hours after the meal, the food digests. And what happens is some of that food will turn to sugar. And that triggers the pancreas to start to produce insulin, and the insulin actually pushes that sugar to various parts of your body. If I'm living with diabetes, that might not happen. So for a type 1 diabetic, where, most cases it's among kids, the pancreas produces either very, very little insulin or no insulin at all. So I eat the meal, it digests, no insulin is being produced, so therefore my blood sugars are going to rise. Whereas with type 2 diabetes, you build up a resistance. It's called insulin resistance, which basically means that same thing happens, the body produces insulin, however the pancreas produces the insulin, but your body builds up a resistance to it. So basically that's going to allow the sugars to rise in your bloodstream again. I think a perfect example, the Boston Marathon. What do they do the night before? They pile up on carbs. But those carbs are going to turn to sugar, and they are going to run 26 miles. So that is a great way to give them energy. Unfortunately, for someone living with diabetes, that's not the case.
Okay. There are staggering statistics as how many people in this country live with diabetes.
Yeah. So there are currently 30 million people that are living with diabetes. When I was here 2 years ago, I think the statistic was 26 million. So it shows you that this is increasing as opposed to going down. And when we look at what is called prediabetes, or for some folk, they might have heard, the doctor may say, you better watch it, you're borderline. Those folk and people who are walking around with diabetes and don't even know it, that number increases to about 86 million people in the United States today.
Really?
So this is very serious, pre-diabetic.
Oh my goodness.
Yeah, 86 million.
Do they have a reason for the increase?
Not really. I mean, some of the things that we see is, it depends on your diet, it depends on if there is a history of diabetes in your family. Those are all risk factors. If you're obese, if you live a sedentary lifestyle, all of those are risk factors that contribute to it. But why this is on the rise, we just don't know. We just don't know.
And we do hear in the media that child obesity has become a real problem in this country.
Childhood obesity, I call it the world of casual convenience. It's much easier to go to a store or whatever and buy chips and a soda, as opposed to preparing a healthy meal. And I think especially at breakfast, for example. And so what we're seeing is that kids are always on the go. And it's much easier that while they're on their way to school, or when they get to school, before they actually go into class, they're stopping and they're buying Coke or whatever, and potato chips or some other kind of snack, all of which are going to contribute to obesity later on in life. So some of the things that the Diabetes Association has done is we've been very instrumental in trying to get rid of sugary soda in vending machines in schools and replacing that with healthier alternatives. We're also trying to work with some of the local smaller, mom and pop stores, if you will, and saying, okay, would you be willing to put water or, sugar-free beverages that are, closer to the front, so that would be a choice, that would be an option. But it's a process, and it's an ongoing process, because we're talking about, number one, changing lifestyle. We're talking about two, what's the money maker for a mom and pop store? It might be the sugary beverages. So it is a process, but we're working toward raising awareness about that and just coming up with healthier alternatives.
I think when we were talking, you had mentioned a projection of children from the age of 1 to 15?
So I look at it this way, you know, if you have a child that's 7 years old and is morbidly obese, by the time they're 15, not only will they probably have diabetes, but some of the other comorbidities that come with diabetes. For example, a kidney disease, you know, maybe being on dialysis, because that is part of this process. Cardiovascular disease, you know, neuropathy, which generally we find in older folk. But these are things that can happen, you know, to someone who is really suffering from diabetes if it's not managed. And you know, I want to emphasize that because I think it's really important for people to be aware of the fact that it can be managed. And by being managed, you might not have some of these comorbidities.
Exactly. So when they talk about not living a sedentary life and getting the kids out there and active and moving, there's a real reason for that.
Yeah, definitely. And I think, you know, in many schools, recess is gone. You know, I remember when I was a kid, you know, you had recess every day. It was probably about 15 minutes to a half an hour, but it was actual physical activity. And just because of budgets or whatever, a lot of that is changing. So kids are not getting that physical activity that they really need. You know, weekends, you know, it's television or whatever. I mean, it's just not part of the normal lifestyle, if you will. You know, so it might be an afterthought, or if you know, kids are in athletics or something, but most kids aren't.
Yeah.
So, you know, it's very important to be able to introduce that or have that as part of school curriculum, as well as, you know, the after-school programs, the Y, the Boys and Girls Club, that do have those things, but getting your kid enrolled in that so that they do get physical activity, which is so vitally important.
Before we came on, you just mentioned a statistic of child obesity in Mansfield, which I was really surprised at.
So it's the statistic for both adults and children. And, you know, unfortunately, getting localized data is really hard, but this was for Bristol County. But I was still very surprised that the state percentage is about 24% of the state has, you know, folk that are either kids or adults that are obese. Mansfield or Bristol County is at 29%. So it's higher than the state average. So needs to be some work that needs to be done around that. Yeah.
Now, the American Diabetes Association is changing its role in support and education for diabetics.
Yeah.
And I was wondering if you could explain that.
Sure. So our role has changed to the extent where diabetes is still our focus, and we're going to continue to do that, raising the awareness about diabetes and getting people referred or into whether it's education or programs that are going to benefit them is a priority. However, we've changed from doing direct services. You know, 2 years ago, we were actually going to various sites, and we were working with diabetes educators or nurses around just providing education, you know, to people living with diabetes. And we're looking now at more scalable. You know, how can we have a greater impact? So that not only involves the education, but we have to get the change makers, the policy folk that are on the, you know, and also look at what is preventing or what are some of the barriers for someone getting good health care for their diabetes treatment. I mean, you know, there's affordability issues, there's transportation issues, and it can go on and on. So how do we address some of those, which are called social determinants of health? How do we address those so that the result is more optimal than it is today? So that might help with changing the behavior. And I use an example. You know, you go to your doctor, and your doctor says, you know, you need physical activity, and, you know, I want you to walk, whatever. And you say, okay, that's great, but where I live, there are no parks, or there's no green space, or, you know, so that's a barrier. So how do we work with, so you want to work with the Parks and Recreation Department to say this particular community could really benefit from a park that's safe, that's well lit, you know, so that people can enjoy it but get more physical activity. So it's really approaching health from a very different perspective. You know, historically, you go to the doctor, if you have diabetes, you're treated for your diabetes, You either do or you don't adhere. Whereas now we're really looking more so at what are some of the other barriers, and how do we address those? And would that help? Would that, get someone to be more adherent? Would that, decrease the rate of diabetes?
For seniors, a lot of time it's monetary.
It's monetary. So, and I think the perfect example is I always get seniors who call me and they'll say, oh my goodness, I have a meter, didn't cost me much, but the cost of strips is really just so expensive. And what's happening is many seniors are buying the strips and so they'll test maybe once a day when they may be required to test 3 times a day in order to save. One of the things the association is doing is, especially under our advocacy division, is we are really looking at insulin affordability and then all of the other, secondary things that go along with that. And how do we get that to be more affordable, especially for seniors? Working with CMS, which is Medicaid and Medicare, to come up with some other alternative. So those are some of the things that we're trying to do to address that, because that is a problem. And I share this with you. When my stress level is up, my blood sugars go up. So if I'm worried about how am I going to afford, the strips or whatever, that causes some anxiety, and of course my blood sugars will go up. And so that's something, it's like a cycle, because it just gets worse as opposed to getting better. So how do we address that and get that so that there's less stress and people can afford, the medication that they need as well as the strips?
So you're working on community levels, state levels, and country.
Yeah. So we're actually, I just joined a national committee that is out of, the national, they do a lot of quality improvement. That's part of CMS, it's part of Centers for Medicaid and Medicare. So I'm on that particular work group, and I'm really excited about that because it's a great way to see what's happening nationally. But in addition to that, we definitely work at the local level, work with local partners, as well as the state level. One of the things that I'm really proud about, and I think that this is the way to go, is bringing various stakeholders to the table, whether it's a bank, whether it's a health system, or a community organization, because many of these groups are able to do some of this direct service work that we are not. And so, we are able to provide the training and the resources for those individuals to actually go out and implement the programs. We're also doing some work now, and we're really looking at community health workers. And community health workers are basically, I think that they're the glue between the community and the provider. So most of them work in a hospital setting, and they're more like a navigator. So they would actually help a patient to navigate their way through. They do a lot of follow-up after the fact. So they're really very important. And ADA has been looking at how do we, accredit them, as a professional group. And so that's something that's in the workings. And there are a few other diabetes organizations that are doing the same. So this is really exciting because there is a lot of merit in community health workers, and their importance is, invaluable.
It seems that the environment is changing in the medical field to a more integrated environment, so that if a person has diabetes, you're working with many different people to try, whether it be financially or just physically, whatever it branches out to all.
Definitely. I mean, and I think it's the team approach, if you will. If somebody's living with diabetes, they definitely need to see a nutritionist. It's great when the nutritionist is speaking to the provider, and if there's a need for a referral to an endocrinologist, there's that conversation that's going on. And if there are social services or social support services that are needed, you bring in the social worker. So it's a great way to have this dialogue and provide those resources for the patient. And that's really a lot of what the social determinants of health is all about.
What was Project Powerup?
So Project Powerup is it's a camp setting. Historically, they've been very successful 6-week program during the summer. However, this can be done year-round, so it could actually be done as an after-school program. If there is it could be done as a weekend retreat. So just depending on what delivery works best. However, it focuses on nutrition and physical activity and the importance and how is that integrated. And what is unique about the program is we do require the parent to be actively involved in the education as well. Why is that important? They purchase the food.
Right.
Okay, they prepare the meals in most cases. And so this is learning how to prepare healthier foods and, and also, it's a healthier family in the long run.
The Food Hub.
The Food Hub. Exciting. I'm really excited about this. This was just launched, I want to say 3 months ago. The Food Hub is an online resource for anyone that's interested in learning more about how to cook healthier, more diabetic-friendly foods, if you will. There are, thousands of recipes. What I think is so unique is you can actually plug in. You can go to your refrigerator and say, okay, I have this and I have that, and plug that into the computer, and they'll give you some recipes based on what you have available. And that, so many people go into a panic, like, oh my goodness, what am I going to cook? Yeah. So this is a great way to help. It's a great resource. And you can apply, it's free, and you can, register right online, and, that communication will begin immediately. So we're really excited about that.
Now, do people go through the American Diabetes Association to get to the hub?
So you can go to our website, diabetes.org, and actually you'll see Food Hub under recipes, and the rest is, it's all self-explanatory once you get there.
What a great thing.
Yeah, I love it. I love it. I just,
Because it is very difficult. You may say, oh, I didn't have time to get to the grocery store.
Right.
What can I do tonight?
What can I do tonight? That's going to be healthy.
Yes.
That's going to be low in carb or whatever. So yeah, it's a great resource. Great resource.
So bringing this all to the Mansfield area, people who have diabetes or have children who have diabetes, what do we have locally that can help to support them or educate them?
So we have a few things. We have partnered with the Hockomock YMCA is one of our, as well as Sturdy Memorial. And Sturdy Memorial is actually part of this. There's a coalition that I'm a part of that the Hockomock Y has put together. And some of the resources that they have is, if you're not living with diabetes, but remember I had said about this, borderline or pre-diabetic, they have a diabetes prevention program which people can enroll in, and it's a year-long initiative. Which provides a lot of education and what have you. There are also diabetes support groups that are done through Sturdy, and it's to my understanding that what Sturdy wants to do is they actually want to be able to come into a community. So say, for example, if there was a group in Mansfield that was interested in getting together and having this, a representative from Sturdy could come in and help and do that. There's also a program that I don't know if it's up and running, but we have been talking about it, which is going to be, for kids at risk of obesity or maybe obese, with nutrition and physical activity as well. So there are resources, in the community where you say, okay, let's localize this. So there are some resources that are available and accessible, to anyone that needs those. And if you call the ADA, the association, our local office, we can definitely refer you to those specific programs.
That's really great, because there may be somebody who's just been diagnosed and they are getting support from their doctor's office. But when you're at home alone and all of a sudden it hits you and it's like, well, what do I do now? Or where do I go? Or I don't understand this, and maybe I don't want to go back to the doctor's office,
And I would also say, too, that at ADA, that's another online program that we have called Living with Type 2. So if you're newly diagnosed, and just as you said, people go into a, but I remember when I was newly diagnosed, the first thing I said was, well, what can I eat? So they actually will begin to share that with you. So you can enroll in this program. It follows you for a year and provides you with various resources on proper foods, medication, support, all of those things. And that I think, combined with your local resources is pretty helpful, especially for someone who's newly diagnosed, at least to get them acclimated and to feel a little more comfortable with living with the disease.
I was reading something in the doctor's office, and it was a pamphlet on diabetes, and a woman was sharing her journey, and she said, I was just diagnosed, and I was frantic, you know, and the person who was working with her said, we're going to take it one step at a time. You know, we're going to first deal with maybe having to test yourself, and then we're going to work on your food and your food choices, and then we're going to work on your exercise, but taking it in doable steps so that
totally
your
agree.
stress level does not go up.
Yeah.
And you can see that it is all doable.
Exactly, exactly.
And becomes part of your lifestyle.
Exactly,
You know? So that kind of brings us to what are the new things that might be out to help diabetics?
So we had talked, I think, the last time about the good old bionic pancreas, specifically targeting people with type 1 disease. This device actually does the work of the pancreas, and very hopeful. Unfortunately, there were some glitches, but it's to my understanding that they're still, you know, running full steam ahead to get this on the market. It's exciting. I've actually had two of my colleagues who are living with type 1 that were in the initial study in the trial, and they raved about it. They raved about it. So this is very promising. There is also, you know, one of the pharmaceutical companies has what I think it's called a single loop kind of system. So this is something else. It's a pump, but it actually does a lot of work for you. And so that's something else that's very helpful right now for folk living with type 1 diabetes. So it's exciting what's happening. You know, I don't know, maybe some folk have seen the commercial, but there's actually a meter now where you don't have to prick your finger and test, but you can actually apply the meter to your, just some kind of a patch, and that will read your blood sugars. So things are getting less invasive. But, you know, once again, it's a process. It's a process. But things are looking good when we talk about what's new and innovative. So, yeah, I'm looking forward to seeing what else is out there.
Because with that many people living with the disease, you know, there has to be a lot of research.
It has to be. And I would say that, you know, that's one of the other things that the association has been really instrumental in. We have something, so NIH, the National Centers, the National Health Institute, does provide fellowships and grant opportunities for researchers. But usually they are more seasoned, more well-known, they've been around a while, and the association has really been working with innovative, new researchers who are coming up, you know, and have been funded. So I'm really excited about just some of the new research, and you know, as I go through some of it, sometimes I, wow, this is so cutting edge. And one of the things I like about that is that gives us an opportunity to invite that researcher to come in and maybe speak to a group of our constituents about what they're doing as far as research is concerned around diabetes, whether it's type 1 or type 2.
So there's hope.
There's hope.
There's always hope.
There's always hope. You know, you might not see it, but you know, in the background, there's a lot going on to try to arrest this disease. So yeah.
So if people have questions or want more information about diabetes or research or whatever, they can contact the association?
They can contact our office, and we will direct you to the proper person.
Excellent.
You know, because we also have a national office where there is a, you know, that's more like the clearinghouse, if you will. But there are some things that we do locally as well.
Excellent.
So, yeah.
Thank you so much for coming and
you.
updating us on what's going on in the American Diabetes Association and the great work that they're doing.
Well, thank you.
And thank you for joining us today on The Learning Curve. We hope to see you next time.